So I've asked doctors, and I've asked a lot of them, and they say they've never had one class on nutrition.
No.
And so if food is medicine, you believe that, I believe it. And there's not one class in terms of that. So, and that gets back to the whole thing on the incentives are not structured properly.
Congressman Buchanan, so wonderful to have you on the Doctor's Pharmacy podcast. I've been waiting for this moment for a long time. You know, we've been working together over the last 3-4 years to try to make shifts in food policy and Medicare and health policy to address this incredible epidemic of chronic disease, which I think is a national emergency. And the good news is that we've been able to accomplish a lot. And I want to talk to you today about some of the amazing work that you've done and that we've collaborated on to actually start to move the needle and address this real crisis we have, which is obviously burdening our country with enormous suffering of chronic disease. It's costing the economy, $4.5 trillion a year. Most of that's for chronic illness. It's threatening our national security, our kids' academic performance, and military readiness. And it's something that, you personally have been very passionate about for a long time, both from a perspective of a legislator and leader in Congress, but also your own personal health. So I've really kind of appreciated your commitment to this issue and your willingness to work across the aisle to get things done in a place where people think things don't happen. But, Congressman, you for those who don't know, Congressman, I did the introduction earlier, but you're the chair of the Ways and Means Health Subcommittee, which is probably one of the most important committees in Congress that oversees all of Medicare, which is over $1 trillion. And, you really are one of the first in Congress to make prevention and treating chronic disease with food as medicine as one of your top priorities, which is amazing. So can you maybe start by kind of telling us why is this so important to you, and why do you think we need to really focus on addressing this chronic disease epidemic with prevention and lifestyle as treatment?
Well, Mark, let me first just thank you personally. We have had a lot of opportunities to meet and visit, and I'm so excited about what the differences you've made on a lot of different fronts, and I look forward to it. And I know that we're looking at having a hearing coming up congressionally, and I'm excited about that and the possibilities there. By the way, I just wanted to mention also, I was with a young lady yesterday, and she was telling me about her father or grandfather is 98, and they contribute his being 98 to you. He listens to your podcast. I'll just tell you, I thought it was kind of cute, and he's active and engaged and going like heck. So I thought it was pretty big thing there.
That's very funny.
I for whatever reason, as a blue collar kid, one of 8, I just remember when I got my wife and I got married. I met. They had a neighbor. She wrote a couple of books or something. L. Davis. I think I mentioned that to you. I don't know if she's been. That's a long time ago. I don't want to date myself too much, but I just happened to pick it up and start looking through a little bit, and a lot of it made sense to me. And because we're in such a competitive world, and I've had a family that are diabetics and heart disease and all these kinds of things. So I've tried to stay focused on that, and I have my own discipline where I try to the best I can. I always say it's 80-20, but to me, it all boils down to a lot of this is diet and exercise. And I'm just taking it from my own personal story. I've read a lot of books, looked at a lot of things. For me personally, to be able to perform at a fairly high level, I'm not a doctor or anything, but it's one of those things where I've read your books and other books, and I've been doing it for 20, 30 years. And I think it gives you the slight edge, the difference. And as a competitor, whether it's in business, sports, or anything else, it makes a huge difference how you feel and think and everything else. So that's why now being in Congress, a lot of people don't want to touch some of these difficult, challenging things, like whether it's the debt and interest or what's going on in terms of healthcare. You mentioned it's over $1 trillion just on Medicare alone. But when you look at the data, it's basically pretty shocking. I was looking at, again, refreshing my memory on some of this stuff. But the obesity, for example, is 40%. For children, it's 20%. But yet we only spend 3% on prevention. And that's my whole focus has been, how do we not get cancer or heart disease to begin with? Someone mentioned to me 30 years ago, I was at a seminar in Dallas, and they mentioned that 50% of people who have their first heart attack never see the next day. Well, we've had a lot of heart disease in our family. So I'm just saying, I'm thinking to myself, how do you avoid that to begin with? Now, some things are genetic, you know that better than me, but there's a lot of things that can be dealt with without having to go through a difficult process in terms of heart disease and some of these other things. So that's why I'm so excited about your leadership and where you're at. And I know we're going to get into different things like processed food and stuff like that. And that's the other big thing. But diet and exercise, 80%. Then the other percent is all the, I just was thinking about it a couple of days ago, you know, getting enough rest, stress management, and all these other things. But these are two gigantic issues when you add them together. Where it's in my life, it's like 80%. I thought about it. Some people it might be more or less, but it makes a huge difference. Those two areas in terms of what my thinking is.
Yeah, you're probably one of the healthiest congressmen I've seen. You know, a lot of your colleagues are not so healthy. You know, we had a group of them over to your house in Washington on the deck, and we had a wonderful meeting talking about these issues with about 14 or 15 of the members of the health subcommittee of the Ways and Means that are overseeing Medicare. And they're all very excited to learn, but you know you're an example of what it takes to actually create good health for yourself. So I've eaten with you. I see how you take care of yourself and exercise. It's very impressive, and I think it's really helped you understand what's needed for America, which is we can't sustain this anymore. I mean, it's not a left or right issue. This is an American issue that is threatening I think our whole nation in a way, because we are being burdened by the economic weight of the cost, which is just for diabetes alone for Medicare, I think it's $1 billion a day, which is almost completely preventable, and the effect on just the amount of suffering. And I think the CBO estimates that pretty soon the Medicare Hospital Trust Fund will be running out of money in 2035 if we don't do something about it. That in the next 10 years we're going to spend just $4 trillion just on obesity alone through the government. And most people don't realize that, the government accounts for about 40% of all healthcare payments, whether it's through Medicare, the DOD, the Department of Defense, VA, in the health service, federal employees, all the federal and state programs. It's really a huge amount of the healthcare costs. So the government has a big lever that they can pull. And so I'm been excited about some of your initiatives around Medicare. And maybe we can talk about your new initiative, which I think is something we worked on for a while, which is this whole idea of treating chronic disease patients with food as medicine through what we call medically tailored meals. And what's really exciting is working in a bipartisan way, you've been able to get this through the committee. And I'd love you to sort of share a little bit about why you're excited about that and this new Medicare demonstration project, because the committee just passed this groundbreaking pilot to offer medically tailored meals to people who are leaving the hospital with chronic disease like diabetes or heart failure to really help improve their health outcomes. So tell us about why this is important and what you hope to see happening with this.
Well, in terms of food as medicine, I had a doctor mention, very successful doctor, 30, 40 years practice as a surgeon, I think he was. And he just wrote an article on food as medicine. He said, I wrote a lot of prescriptions for drugs, but he said, I never wrote a prescription for food. And he started to rethink all of that and wrote a big article. I think it was in Forbes or something. And I called him up and had dinner with him. But, a lot of people are coming around realizing that plant-based diet can make a huge difference. And I think it's important that we make sure that what we're helping the seniors and others with, something like a plant-based diet, because a lot of the food that we eat, and you know this better than anybody, because what I've read, what you've put out there and others, is highly processed food. So they're not getting the nutrition that they need. And I think that's one of the biggest challenges, and that's why we're so excited about this bill and legislation, is to be able to move and help our seniors. I'm in an area in Sarasota, Tampa Bay area, where we have a lot of seniors, and a lot of them are 65 and older. This will make a huge difference, and I'm very excited about it. It's bipartisan. And again, I just want to thank you for your leadership and all you've done in this area, because it's helped fill in the blanks for a lot of the stuff that we're doing.
Yeah, I mean, I think you're right, and the 40 hospitals that you sort of directed to for the Center for Medicare Services Select to actually implement this approach will then provide the data to show that yes, and we know the outcome is done right, that people will actually do better. They won't end up in the hospital over and over again. They'll need less medication. The cost for healthcare will go down. Their quality of life will go up. And the goal, really, I think, ultimately with this pilot program, right, isn't it, Vern, to actually help make this a benefit for all Medicare recipients, not just those who basically are struggling.
Yeah, well, that's what we're trying to do is a test, a pilot, and we're hoping to get some good results out of it and then be able to spread it across the country. I know in talking with folks locally, doctors and individuals, they're very enthused about it. I think it'll make a very big difference. And there's no question in my mind, the whole idea of food as medicine is where we need to go and consider. And a lot of these programs they put out in the past just don't make a lot of sense. But this is an area we can work with the senior, especially if you think about Florida, but the country, it's going to be a big opportunity for us.
It's 100%. I mean, I was talking to somebody the other day who has a company that basically works with Medicare Advantage. I know you're very focused on Medicare Advantage as a way to do innovative programs, and they've done this with Medicare Advantage, where they save $6,000 per diabetic Medicare Advantage patient, and the average cost is about $9,600. So you're saving almost 2/3 of the cost. And if you do the math, there's I think 65 million seniors on Medicare, 16.5 million have type 2 diabetes. If you save $6,000 per diabetic using this diet approach, basically helping them change their diet to reverse their diabetes, not just to prevent it, you would save $100 billion alone just with that one approach. So that's kind of the direction we're trying to get to, where we can help the folks in Congress and also the Congressional Budget Office, which scores these things as something that actually can make a difference in reducing costs, because they often see prevention as a long-term issue that won't pay off in the short run. And I think these what we're actually going to show hopefully with this is that this medically tailored meals program it can actually help, and we can even expand on some of those things. So that's really pretty exciting. The other thing that I'm really excited about is this bipartisan Congressional Preventive Health and Wellness Caucus that you started with Wisconsin Democratic Representative Gwen Moore. And I'd love to hear from you what your goals for the caucus are and how you think it can help enact new policies that are going to make a difference for people's lives.
Well, I just want to say Representative Moore out of Wisconsin is fantastic. We were just on a trip together, but the thought is what can we do with this caucus? And we think we're going to be able to work both sides of the aisle to get the message out for this, so for a lot of the things that we're trying to do. But the reality is that you talked about diabetics. I think this year is $412 billion just as the cost. And then you're looking at another for just heart disease, another $220 billion. How do we prevent that? And as I mentioned, I've got family members with heart disease and different things, but I know if they had the right diet and exercise, that'd make a big difference. That's why I said early on, it's probably 80% of making those adjustments. We could cut the cost. We're spending as you mentioned, 1.2 billion a year on Medicare. That's going to go up quickly in a matter of 4 or 5 years.
You mean trillion? You mean trillion? You said trillion, but you mean trillion. Yeah. It's hard to even say those numbers, but
it used to be millions. Now it's billions and then trillions. But you're right. But the bottom line is that we've got to find a way to really start addressing with the cost, because Medicare is going to be today's basically 1.1 or 2 trillion, but in the near future you're talking $1 trillion, 4 or 5, and you're not going to be able to pay all the bills. You're going to have to make some tough cuts. I'm an optimist. I hope by doing what we're doing, we'll make that difference with your leadership, and we've got a big team of a lot of capable members, and including both sides of the aisle, that we think we can weigh in and make it a big deal. And we've got to do it. There's been too much talk about it in the past, but now is the time for action.
I think you're right, and I think this prevention and wellness caucus is so important because some things can help, like the recent reduction in prices with Medicare negotiating with pharma to reduce drug prices. I think is good, but it still doesn't address the fact that why do they need the drugs in the first place? Right? Why don't we implement programs where you don't actually even have to use those drugs? For example, for diabetes, like this program was saying, you can get most people off of that. And I think that what's really important is that in addition to this sort of work on the medically tailored meals with this prevention wellness caucus, there's going to be hearings. We're going to be doing one in September, and to raise awareness, but also to look at solutions and what can be implemented in a practical way, and look at what's worked or what hasn't worked, and really look at legislation, research, and how do we really start to treat this epidemic of food-related illness. The other thing I really think that has been exciting about what you've done is really helping doctors, actually physicians and primary care providers understand nutrition. And this is, I think, a big concern for you. And I know you've done a lot of work in trying to drive initiatives that make graduate medical education and undergraduate medical education provide nutrition education for doctors, because food is the number one cause of why we're sick today in America. It's the number one cure, and it's something doctors learn nothing about. So it's kind of all backwards. And a lot of your efforts have been to try to work with Congressman McGovern. You sent a letter to the organization that accredits graduate medical education, ACGME, which is where the government spends $17 billion providing them with money with no strings attached, and you're trying to get them to have some requirements. You're also working with some of the undergraduates. So love to hear like what your thinking is about the importance of training doctors and healthcare providers around nutrition.
It's shocking, and you mentioned it, the idea that they get little or no education going through medical school. And that's what it's been, but that's got to change, and we're trying to do everything we can, again, on a bipartisan basis. This isn't, a lot of these things aren't Democrat or Republican issues. It's something we can both work on and make a big difference on. But we're very enthused about the opportunity as it relates to getting more education, encouraging more education. It needs to be a part of the curriculum, or however they, when you think about it. So I've asked doctors, and I've asked a lot of them, and they say they've never had one class on nutrition.
No.
And so if food is medicine, you believe that, I believe it. And there's not one class in terms of that. So, and that gets back to the whole thing on the incentives are not structured properly with allowing the doctors how we pay people. Fee for service is something we have to look at differently, because it's not always in the best interest of the patients in the system. And
Right.
So that's something I want to continue to work on as well, setting up the right incentives, especially as someone that's been in business 30 years before I got in this business. You have to have the incentives right, because if you don't, the train will go right off the rails. And that's what's happened here. We want to have people that are healthier, not relying on, having to take more drugs or get cut or whatever.
I think you're right. I think what you're talking about, for those people listening, is we have a system of healthcare right now where doctors get paid to do more stuff, not to actually get people better. And that's what we call fee for service medicine, as opposed to value-based care, which is what you're working on, which is how do we implement programs that pay providers and people doing the right thing, which is helping improve healthcare outcomes and reduce costs. So you get paid if you actually get people better, not just giving them more and more drugs or more surgery. And it's something that actually there's already a lot of initiatives within current Affordable Care Act for this, but it really is more about care management. And we're talking about here is something really even more radically different, which is how do we actually truly improve healthcare outcomes and reduce costs by making people healthier and using food as medicine to reverse chronic disease. And I think that's where the most leverage is, and the most both possibility of ending suffering for people and also reducing healthcare costs. So I think this is so key. And as you mentioned education, my daughter's in medical school. She's in her 4th year of medical school. And basically the way it works is they just have to study for the exam. And if there's no nutrition tests questions on the exam, they don't teach any nutrition. So basically the curriculum is all designed around passing the test. And if we change the test, we can change the curriculum. So I know that's another thing you're really working on, and it's so exciting. I also want to talk about this work you're doing around the military, which is so important. I think military people don't realize you have to have healthy people to join the military. And right now, 70% of military recruits get rejected because they're unfit to fight because of obesity or other issues. And there's a whole group of, I think, 700 admirals and retired admirals and generals called Mission Readiness that have really stated this is a national emergency, because the national security is dependent on us having a very able-bodied military. And we see not only people can't get in because they're unfit, but actually when they're in, they're also costing huge amounts of money. I think the Department of Defense spends $1.5 billion a year on obesity-related healthcare costs for the military. and it loses so much. So how are you seeing we sort of address this sort of military readiness and the national security issue around this for the country?
Well, as you mentioned, it's hard to believe, but 17 to 24-year-olds, 1 in 3, can't get in the service because of obesity. And the military is spending $1.5 billion a year just trying to address the problem. And we've got to get back, this whole concept, food is medicine, exercise and medicine. I said it's 80%. You've got to be active, engage every day, and you've got to have a diet that makes some sense. More fruits and vegetables is a big part of it, not the only part of it. But it is a big risk that our country has if we can't find people that are able to serve. And so I think it's something we're going to work, closely together with my Democratic friends. And this is something, again, very bipartisan. We think we can make a big difference in this space. But again, I appreciate your thoughts and ideas because there's probably a lot of different ways to approach it. But the bottom line is I get back to this idea 80%, you've got to get the diet and exercise right, especially the diet, because the food itself, to go back on, just because I missed this point a little earlier, but along the
Yeah.
lines, uh, what really changed my life, and I left part of the story out of it, is I read a book or something 20 years ago and changed everything because in the book was the equation. And the equation simply said, the top line was the nutritional value of the food. The bottom line was calories. And how do you get the most nutritional food for the fewest calories? And so
Right.
I started changing what I eat and how much I eat and everything else. And it made a big difference. So instead of, like a lot of people, you're like a yo-yo up and down with your weight and you can't manage it. I've never had to think about that again. But that
Right.
equation, most nutritional food, fewest calories, and work it at 80%. Doesn't mean you can't have an ice cream or do some other things. But the bottom
Exactly.
line, it makes such a big difference. And that's something we could ideally simply implement. And you might not you might not get down to, everybody being qualified in terms of the military, but instead of 1 in 3, maybe it's 1 in 10. And I was in the military when I was 18 years old, and I remember they took a portion of the kids back then, and you had to go, instead of 6 weeks boot camp, another 6 weeks, that I recall, boot camp, because they had to go to, I think they call it the farm or something, back then, where they had to basically work out and get into a position where they were reasonably in shape to be able to serve. So we're all over this, and we have a lot of, I want to say, military people in our area. I think I got 80,000 I represent. There's millions in Florida and other parts. They've done a lot for our country and made a big difference and a lot of sacrifices. And we need to step up and do the right thing here too.
It's so important, Congressman, what you're doing and how broadly you're thinking about this. The leadership position you have, you're the vice chair of the Ways and Means Committee. For those who don't know what that is, it's essentially responsible for the allocation of a lot of the tax revenue and figure out where the money goes. And so it's really an important committee. And you're the vice chair of that whole committee, and you're the chair of the health subcommittee, which is really in charge of the biggest expenditures basically that the government makes around healthcare and the things you're doing to kind of try to shift this, the hearings you're having, the bipartisan work you're doing. I mean, it's really great, and you're having also have had many other hearings as well. I mean, you were talking about helping with working with a lot of other representatives from both Republican and Democratic sides, and I think it's really heartening to me to sort of go into Congress and help people understand that with our Food Fix campaign that everybody cares about this. It doesn't matter who you are, where you're from. Everybody's got somebody in their family or themselves has some issue, and it's probably just got too big to ignore. That movie Too Big to Fail. Well, this is too big to ignore anymore. and I think in a way, I think you also understand the economics of it as a businessman. You came from business, and you understand that we have to actually be fiscally responsible about what we're doing, because we're going to run out of money with Medicare if we don't actually do the right thing here. So I'm wondering, just as we kind of close, what your thinking is around the willingness of Congress and the Senate and the White House to actually sort of move really forward on these issues, and what the obstacles are, and how people listening can actually participate and help support the work that you're doing and the work that's happening in Congress around shifting the narrative to around, using lifestyle and food as medicine and as prevention and treatment.
Well, as a business guy that's worked with a lot of numbers, I'm an optimist, but I'll share with you, we're 36 trillion in debt. We're running $2 trillion a year deficits, and you can't continue down this road. You mentioned these are big programs. There's the whole thing on Medicare is over a trillion. It's 1.1 trillion. Social Security is 1.5 trillion. They're the two most important programs, probably you could argue in Washington. But at the same time, as it relates to the health portion, I think collectively working together, have this conversation, but have it with all the members of Congress and others. And we're not going to be able to change everything overnight. We're not going to be able to change everybody. But I think we can have positive change and have a big impact. And we've got to do it just because of financially, we've got to make sure we're doing the right thing. But beyond that, you want people that are healthy, feel better. They live in you. There's a lot of discussion today about longevity and everything else. And I know that's something you work on, Mark, and you've worked your whole life on. And look how young you look. And my point is that we've got to do everything we can to work together to get address these issues. They're serious. They're big number of issues. And right, the Ways and Means Committee, we do tax and trade, but we do healthcare, we do Social Security. All the big programs run through there, and it's time for leadership and doing the right thing. And a lot of times it's politically not always correct, but we've got to move in the right direction. And I think if we do, we'll be able to have healthier people and cost us less money. That's my goal.
Thank you so much, Congressman. And I think maybe it would be also great to end by you sharing how important it is for the members of Congress to hear from their constituents, and it actually makes a difference. We think as people listening, the political process is somewhere out there in a space that none of us can influence. We're sort of helpless, but the truth is that your voices matter, and that people in Washington listen, and that change will happen the more pressure comes from the public and the constituents of various congressmen and senators, and even the White House, that have to hear what's going on. I mean, I recently heard someone telling me during the Obama administration, President Obama said to them, look, we want to do such and such and such around food reform or policy or ag, but we need cover. Like we need the public to actually kind of push back and say, this is what we want. So how does the actual individual out there listening start to change their behavior to advocate for the things that they want? Do they call the representatives? How do they do that? Can you just talk about how people get more involved in the political process to support this?
Well, I always tell people, I've been in Congress going on my 10th term, but the bottom line is I'm humbled to be a congressman as a blue collar kid that grew up and built two big businesses. But at the end of the day, I'm a representative. I work for the people. It's not about me. And so I mentioned to all your viewers and everybody else listening to the program, they work for you. And you need to go in and let them know this is really critically important. And the more momentum we can get, helping Mark and others and all of us working together, will have a huge impact on these programs. I'm convinced of it. There's no doubt in my mind, because of my own life, and I know Mark's life and others, it makes a big difference. And it's not that hard. I mean, you just got to have the education, the knowledge for a lot of people. There'll be some people that maybe don't feel the same way and want to go down the same road they're going down. But I believe there's a lot of people that want to feel better, look better, and have more energy and everything else. And that's what we're trying to do with these programs. So I'm very excited and very enthused about where we're at, but there's a lot more progress that needs to be made.
That's exciting. So I'm going to Washington in a few weeks. I'm going to have dinner with you and a whole bunch of members of Congress, and then we're going to do a hearing on September 18th. Everybody can listen in on that. And I'm just wondering what your hope for in that hearing is, and how you envision that unfolding, and what the outcomes you'd love to see from that are.
Well, first off, you gave them the dates. They're welcome to come to Washington if they want.
Come to Washington, fill up the room.
They'll be excited about it. It'll be kind of we're going to have not just Mark's going to be there. We're going to have some others, but Mark will be the leader on a lot of this. But if you can join us, it would make a huge difference to send a big message. But again, I just want to emphasize that I think that America's special, and we've got this challenge, and we need to work together to get on the other side of these issues, these healthcare issues, and get people feeling and looking better. I think cancer and heart disease can be eliminated. Mark can tell you more. He's a doctor. Not everything, but most of it. I mean, people that are more plant-based diet and other things don't have these issues. You can go look at their blood and everything else. And I can just tell you, I'm very excited about working with Mark and working with our members. I think we'll get a lot of momentum with our bipartisan members. And Mark mentioned we're going to have dinner. We'll have probably 20 members of Congress there. I'm going to invite the ones that are could have an impact in the conference in general, have some of the leadership there. So I'm very excited about that. It's going to be a big hearing, and we need to go down this road very aggressively to make sure we're doing the right thing by not only people we represent, but the country as well financially.
Well, thank you so much, Congressman, for what you do, for being the leader you are, for taking the risk, because honestly, there's a lot of forces that pushing back that don't want this to happen. So you're very courageous, and to me, it's been very exciting to work with you over the last few years, to try to move the ball forward. And I can see all the things that have happened. We've started a conversation, at dinner, I guess maybe 3+ years ago. And now look what's happened. We have the Prevention Wellness Caucus. We have this medically tailored meals pilot program. We have efforts around military readiness. We have all kinds of programs that are being implemented. That are in hearings happening. A lot of stuff is really moving. So I just want to thank you for sticking with it and being such an advocate and giving me so much hope for America. So thank you so much, Congressman. And I'll see you soon in Washington, and we'll get our hands dirty and get this done.
Yeah, and let me just say, Mark, again, just thank you for your enthusiasm and what you bring to this. Your leadership is huge. And I think collectively together with other members of Congress and other experts around the country, we can make a big, huge dent in this, and we need to. But I look forward to the 18th.
All right. Thank you so much, Congressman. We'll see you soon.
Thank you. Thank you very much, Mark.
If you loved that last video, you're going to love the next one. Check it out here.